This is chapter 2 for companion animals. So this one is all about safety, handling, and housing. It's a little bit longer. So when you start looking at it, they're going to look at hazards. They're going to go through personal protective equipment. There's lots of objectives here as far as describing handling animals. And then there's special scenarios in there too, like wild animals and other pieces. All right, so industry hazards. So this is part of the terms for this chapter, and this one has, if you notice, it has a definition of hazard right away, and it says anything that can potentially cause harm. And this could be physical injuries, could be chemicals, emotional stress, exposure to noise, anesthesia, and radiation, as well as noise hazards. So if you think about, noise hazards, if you think of a vet clinic, probably not super noisy, maybe some barking and meowing. If you think of the industry as a whole, with any livestock animals, if you think of something like a hog barn, there's lots of squealing and noise. And those workers actually have to wear earplugs. All right, so dangers of mixing cleaning agents. There are certain rules where facilities have to be cleaned. And they point out things like obviously mixing bleach and ammonia is a terrible idea. It does create chloramines, and it can make you really sick. And it does say causes illness, damages airways, and it can be deadly. Biohazards. You guys have probably seen, if you've been to the doctor, they usually have a biohazard bag of some sort. It seems kind of alarming, but it's really not. But basically anything, like if you had an animal go in for something that they weren't sure about, it could be even like a tick on this page, they might throw it in the biohazard bag. And usually it's something that is like tissue that they're not sure about. They might take a sample and test it, and the rest goes in the biohazard bag. If you notice, it says living hazards found in the environment where animals are kept. There could be allergens, substances that cause allergic reactions. Now, keep in mind, we tend to forget our pets can have allergies too. Sometimes our pets are allergic to medications that we try on them, and they might develop a rash just like we would. Zoonosis, that's diseases transmittable from one animal species to another. A great example would be something like rabies. Lyme's disease is another one, and I'm not sure if that's why they have the tick on this slide. Vector, that's living organism that can spread a disease to another organism, which would, the tick in that scenario would in fact be the vector. Fomites, they're non-living objects or materials that can carry disease. And it might seem a little confusing, but even a countertop, if there was blood that was, an animal got cut, there's blood left on it. If it's not cleaned up properly, obviously it can still live on that countertop, whatever disease they might be carrying. All right, some basic first aid training. So always know first aid, CPR. Some schools do offer CPR training. We just kind of touch on it. Obviously, there's two different types actually. There's some for animals and some for people. My classes, we touch on the one about animals just briefly. If you're interested in, helping people, obviously Mrs. McLean's classes, the health careers classes would help you out with that. And I'm not sure if they force you to do that in health, but good things to learn. All right, PPE or personal protective equipment. This is something you'll come across throughout your life. Depending on what job you choose to have. So if you're like, I'm not going to work with animals, this is still really important stuff and things to use common sense with. So it's really to protect you from harm. If you notice the lady in the picture, she's holding a cat, has a stethoscope, looks like she might be a vet tech or veterinarian, has safety glasses, a mask, and really it could be you don't know what that animal has, and maybe she's concerned about bringing it home to her pets. Notice this is long pants, sleeves, earplugs, closed-toed shoes, gloves, safety glasses, and things to think about. If I wear sandals and I'm wearing that, dealing with that cat, if the cat were to get loose from me, get on the floor, could scratch my feet, bite my feet. And it's hard because the people that are really wanting to help animals usually are the ones that animals kind of run away from and get freaked out because they're in a new setting. Radiation protection gear. This is something you maybe don't think about, but like our vet clinic, they actually have all of their workers sign in when they've been in the x-ray room. They have to log how much time they've been in there and how much exposure they have had. And that's something that's very important for their work. Wash work clothes separately to prevent cross-contamination. So obviously if I wore scrubs working at the vet clinic, I would make sure I didn't wash them with my kids' clothing, kind of a thing. There's some examples of PPE, pretty basic stuff. So that letter A, you have earplugs, B is gloves and a mask, C is goggles, and then D would be the safety glasses. And it's different scenarios. So obviously, if I was worried about something splashing in my eyes, I'd probably lean toward the goggles versus the safety glasses because the top and bottom are covered. All right, treating cat bites and scratches. This is one that we tend to forget. Cats can be really quick to bite, and scratching can be an issue as well. But cat bites go much deeper. Their teeth are so sharp, and they do act quickly and unexpectedly sometimes. The other hard part with their scratches, they actually have a hollow spot in their claw. So when they bury their feces, this is kind of gross, but when they bury their feces will get trapped in the claw. And then when they scratch you, they basically, dig that under your skin, so it can be easily infected. And then obviously it's important to know first aid procedures with that. You would want to clean out any wounds. And also think about, especially if you get bit, find out if the cat's vaccinated or not. And then think about, was the animal scared? Did I provoke it? Or was this really odd behavior? Hand sanitation. So facilities should have hand sanitation protocol. This is, depending where you work, especially if you are in the food industry, very important stuff. It does say hand washing is the single most effective way to reduce spread of pathogens and disease. Lots of people, and I know there's other slides in here that talk about hand sanitizer. It's not the best preventative method. You want to make sure you're using soap and water, and it goes through we'll go through it later, but it talks about how long you should wash for. And it does say one-time use gloves only effective if not used more than one task. Sometimes you see that in food industry where they're changing out their gloves because of allergens and whatever else the case might be. So, and it does say wash hands before using disposable gloves. So hand washing, they recommend that you wash for at least 20 seconds. And I don't remember if I think going through the ABCs or singing happy birthday was enough to get there. So if you can't gauge time, that would help you. And then it has step-by-step. Obviously, you're going to want to wash before and handling an animal for any task. What I see often in my classroom is students will take out rabbits, tend to forget that they should wash their hands before they have a snack or go off to lunch. And that's something that's very important. Wash between handling animals. It really depends on the scenario. So if I'm a boarding facility and the animals are kept separate, I'd want to make sure to do that. Or especially vet clinic, you don't know what one animal has. They might be waiting for test results, and they want to make sure that they're cleaning between animals so they're not cross-contaminating. And then washing after you've done cleaning, wash before eating or drinking, and after using the restroom. And then most often missed areas are thumbs, fingertips, and between fingers. So this is that point again. Hand sanitizer is not as effective as soap and water. Sanitizers do not kill a large variety of pathogens, and they're not effective for removing debris. And then use a minimum 60% alcohol. There's different ones out there. The hard part is the higher the alcohol content, it smells, and it also tends to dry out your skin a little more. So things it does mention too, as far as putting on just, the sterile gloves. Choose proper hand size gloves. Sometimes you're stuck in that scenario where, maybe you have large hands, there's only small gloves available. If you're working somewhere, they should accommodate you. Remove jewelry. Obviously, rings and whatnot would poke through. Wash your hands thoroughly. Open the sterile glove package and place inner wrapper on the table. And it talks about basically touching the inside cuff of the gloves. We will go through the demonstration of this so you guys know what it looks like. The other part that might be messing with your head a little bit is if it's a surgeon that's going to do something like a veterinarian, they have individual packets of gloves. It's not just the box all the time. So that's why it has the open glove package. But we'll go through this too. So then it talks about removing them too, because the whole point of this is to have the bad stuff on the gloves, not touching your hand. So it does talk about peeling the glove away and turning them inside out. So you're not touching the outside at all. You just be touching the inside. Facility sanitation, cleaning, removing physical debris from surface. Disinfecting would be remove most of the microorganisms from a surface of equipment. Sterilization removes all microorganisms through heat and pressure. So obviously disinfecting happens on the surgical table. It's hard to sterilize that surface. Oftentimes the equipment that is used is sterilized because they can go ahead and put it And it's basically like a big pressure cooker to heat it up to sterilize everything. Heats it hot enough to make sure that it kills bacteria. Otherwise, things that they will use, they do have scalpels that are plastic, so they can throw those away versus the stainless steel. All right, OSHA. You may or may not have heard of OSHA, but they are an organization that will check out companies to make sure they're following all the employee rules and regulations. So they're trying to help protect employees, but sometimes they make some silly rules that are a little extra. They do, training. So like even teachers, we have to do a bloodborne pathogen training. We have to do, it's like disposing glass, all different things like that you might encounter in your classroom. And then they have a hazard analysis, like managing, any risks. Like it could be something that is a trip hazard, or in the case of, the vet clinic, it is their x-ray machine and the radiation level. All right, sanitation plan. Obviously, if you look through this, they're in a surgery setting. The hard part is they're trying to make sure that their tools are sanitary, it's still in that sterilized field, and not, going to make anybody sick. And notice it does have a plan, should indicate methods of chemical used, quarantine areas. So if there's an animal that they don't know what it has, they might keep it in a separate area away from anything else. And then they go through the materials and equipment, because obviously if they're doing a surgery like this one, they can't go back and use those same tools on the next surgery. They have to have enough tools to make sure they can make it through everything they've planned in the day. And in the bottom too, they have, bedding, water, food bowls, all that stuff. They need to have enough for all the animals so they can go through and sanitize in between. All right, safety data sheet. Basically, this is something that every product has. So even if I'm using a bottle of Windex glass cleaner, it will have, what I should have on my body. It might say something like safety glasses because I could get it in my eye, which is kind of silly to most of us because we've probably all cleaned with it. It does also give you like tools, or not tools, but tips for storing. If I got it in my eye or I swallowed it, it would have that first aid piece. What should I do? Type of ventilation needed. Basically, if I'm using it, should I have an open window? Is it going to make, take my breath away if I have it in a tight space? And then can I mix it with anything else? It has all that stuff on there. And they typically have a series of symbols. So if it's poisonous, it might have the skull and crossbone kind of thing on it. It does say use separate cleaning equipment for each area, help prevent cross-contamination. So if I had a rag and I'm cleaning out a space, I should use a different one for the next area from a different animal. And oftentimes, to be honest, it sounds wasteful, but places like the vet clinic will use paper towels because they can throw it all away and they don't have to worry about that. Waste removal, they must comply with regulations for biohazard. Animal tissue and fluids are considered biohazard. Containers should have secure lids and be in separate area from the animals. Cages and waste containers should be sanitized frequently. Laundry, there's certain specifications. Obviously, they're going to use typically hot water settings. It's a little bit more costly because they have to pay for heating the water, but they also, it's kind of gross too. They have to remove all the solid waste before they wash them. They have to use a disinfectant, so having that higher temperature water is also going to help too. So, housing. This is an image of a chinchilla if you're not familiar with chinchillas. It does have, allowing animals to be stress-free and feel safe. That really depends animal to animal. They all act differently in different confinement, and that's hard. Animals should be able to express normal behaviors. So some things that would be unusual for something like a chinchilla is when they start nibbling on their own tail. It's kind of a weird, either it's like a nutritional deficiency or behavioral piece. So maybe they're not happy. Some animals need to have a buddy in the pen. Some absolutely cannot because they'll get aggressive. And then notice it has material should be non-porous for easy cleaning. It's kind of misleading because the cage they're showing you is wood. Wood is porous. This might just be a play area for the chinchilla. We're just seeing one snapshot. And it does have access points, prevent animal from being exposed to cleaning. Basically, if you're going to clean a cage, you should have somewhere else for that animal to be, or someone could play with it, hold it while you're going through the cleaning process. And then ventilation prevents the spread of disease in the facility through filtration.